My name is Felicia Walker, and I am a student at MUW. I am in the RN to BSN program, and I will be doing some education on the national opioid crisis and what somebody on opioids might look like, and how the national opioid crisis has affected healthcare, and how we can help and how we can help in our communities. So, first of all, what are opioids? They are a class of drugs that are derived from the opium plant. They act in our brain with a pain relief mechanism, and they can also be used for anesthetics. They were first introduced in the 1990s by pharmaceutical companies. They told hospitals and physicians and directors that they weren't addictive. So the healthcare facilities moved forward with that, and they started prescribing them to more of their patients after surgery, for pain relief, for chronic pain, back pain, things like that. And so it kind of flooded the market with opioids. And then you fast forward, and we're finding out that opioids are very addictive, and they have destroyed a lot of lives. And here we are in this national opioid crisis. So the doctors are now trying to dial back. They're trying to not prescribe as much. They're trying to, monitor it, just because we've seen these prescriptions become very addicting. It's filled our communities. When a prescription is written, the patient runs out. They might go back to the doctor with drug-seeking behavior. They might come up with a new ailment that is wrong with them, something to get them pain pills. And if that doesn't work, then they might turn to the community. A lot of people sell these opioids. They somehow get prescriptions for them and they sell them. And sometimes they use the non-prescription opioid, heroin, just to get their fix. We're seeing these opioids all over the community. We're seeing them in pregnant mothers. We're seeing them deliver babies who are addicted to opioids and have to go through withdrawals. And then we see a lot of opioid overdoses, sometimes resulting in death, and that's very tragic. So where are we at in that? In 2016, we had 130 over 130 people die every day from opioid related overdoses. And then in 2018, we had 10.3 million people who were misusing opioids, whether it taking more than the prescribed amount, taking someone else's pills, or taking that illegal opioid heroin. And then we're seeing these opioids put a strain on the healthcare system, and in that way, there are increased visits to the ER. In 2005 to 2015, we saw ER visits double for opioid related illnesses, injuries, sometimes just that pain seeking behavior. And then in that same year, we're seeing inpatient stays that have increased up to 84%. And a lot of these ER visits are Medicaid patients, and hospitals have a hard time being reimbursed by Medicaid. A Medicaid patient is twice as likely to be prescribed an opioid, and so that starts the whole process of that seeking behavior and wanting to have that opioid in their system. For the hospital, a opioid patient versus a regular patient, that opioid patient is going to cost 556 times more. It's more expensive to have that opioid patient in the hospital. A lot of opioid users have comorbidities. They have HIV, hepatitis, depression, and anxiety, and that makes for a longer hospital stay, and it makes for a more expensive hospital stay. So what does an opioid patient look like? So, I've been talking about this drug-seeking behavior. So, they're going to want their pain pills, and they're going to take them whether they're at home or at work or whatever. So you might see drowsiness, nausea and vomiting. You might hear somebody complain of constipation or urinary retention. If in healthcare, if you're hearing somebody complain of those things, then that might be a light bulb that goes off to say that maybe they're an opioid user. And then this is in all walks of life. So it could be your coworkers, it could be healthcare workers. So for your coworkers, you're going to see problems with attendance. They're going to call in a lot, or they might be late to work. They might take longer work breaks. They might come back and be drowsy. They might have mood swings at work or anxiety at work, and just odd behavior. A lot of jobs, and I know healthcare facilities have a drug policy. So for anyone who is suspected of using drugs and alcohol, you can report that. My hospital has an anonymous tip line. You could report that to a trusted person in management or supervisors that you might think that someone might be using drugs on the job, just so that you can get those people the help that they need before they get to the point of overdosing and loss of life. Because like I said, those opioids have an anesthetic property to them, so they're going to slow down breathing. Your respirations are going to be slow. You're going to take too much, and you're just going to stop breathing. You could have cardiac arrest. So there are a lot of problems with that. So what can we do? Educate your family, your friends, your children. Talk to your children about drugs before they have to hear about it on the school bus or at work. You definitely want to lightly expose them to that and the harmful effects, and educate. Like I said, I'm in healthcare, so educate your patients. When they go home on a pain prescription, stress to them how addictive these are, and how they should only be used for moderate to severe pain control, and they're supposed to be used for a short amount of time. That after procedures and things like that, you will have pain, but it will get better. And you want to educate your communities. There are a lot of drug take-back programs. A lot of pharmacies offer that. I know Walgreens does. They have a special day where you can come and turn in your unused or your unwanted pills, and they will safely discard of them. You don't want to flush those down the toilet, because some of those medications, those will be put into the water system, and you don't want that to be in the community for everyone. So you definitely want to utilize those drug take-back programs. Not only that, you want to educate your patients, their family members, if they see addictive behavior, if they're taking too much or the wrong amount, you definitely, so there's somebody in the house who has problems with pain pills, you want to keep those locked up. You want to keep those in a bathroom, in a hot cabinet, preferably your private bathroom that not everybody's going to be going to. And when people come over, you want to avoid letting them in there. You also want to talk to your community and see where there are problems. Reach out to those community members, because they're going to know where these drugs come from and who is doing this kind of stuff. Because we just want to educate, and we want to keep everybody in our community safe.